And welcome to the Ohio Workforce Coalition's November webinar. Today's session features speakers from across Ohio who are committed to advancing the interests of Ohio's workers, employers, and workforce systems. I am Rebecca Kushner, Director of the Coalition, and I'm proud to bring you today's session. The Ohio Workforce Coalition works to grow prosperity across Ohio with skilled workers, quality jobs, and equitable systems. You can learn more about the coalition on our refreshed website at ohioworkforcecoalition.org, where we will post the recording of this session and where you can find other resources and information about workforce policy in Ohio and across the country. Due to the size of today's audience, we are using a webinar platform and only our panelists will be able to speak and share their cameras. That's a little bit different than usual, but please do use the chat or Q&A function to share your thoughts and questions, and you may certainly send me a message if needed. Because we felt strongly about including as many voices as possible, we have a packed agenda and we will be jumping right in. After today, we will share the contact information of our speakers and a recording on the website. We will also be following up to any questions we're not able to field today with written responses. So again, thank you for being here. Please check out our website. And I am going to turn it over to our first presenter, Tony Cunningham.
Thank you so much, Rebecca. And good afternoon, everyone, and welcome. My name is Tony Cunningham, and I serve as a state network director for a company called Unite Us. And we are launching connected and coordinated care networks across our state. So I represent Unite Ohio. Next slide, please. So what is Unite Ohio? Unite Ohio, I'm not going to read the entire slide, but I would just say that we are part of a national network where we go into communities and help launch coordinated social care and through a platform that allows you to have an end-to-end solution to refer individuals to needed services that you may not be able to provide, but also to follow that care journey and to close that loop on that referral and know exactly what the outcome was and how individuals are faring in our community, getting their needs met, and ensuring that we are connecting people, they're getting everything that they need, and they have the ability to continue to move forward. This is important when you think about workforce, because as individuals are training and getting the needed skills that they want to obtain in order to move forward, they need to have all of their needs that are not work-related met so that they can focus on growing their skills and talents. And so we are happy to be a part of communities where we help connect people in very real time through our platform. And we also provide that data back to the organizations who are participating, as well as our government entities and our community leaders, so that we have data to show what the needs are in our community, how we're meeting them, and if there are any gaps in that. So why are we here? Again, we're here to support. We're here to be the backbone and support as you all work through our workforce development efforts to ensure that we are moving people forward and getting them the support that they need as they move towards self-sufficiency. Of course, we influence all of the social determinants of health, and we all know how important that is when you are supporting individuals, whether they're getting back into the workforce or whether they're entering the workforce for the first time. We want to make sure that there are not barriers that trip them up that have nothing to do with their ability to be at work and to do the job at hand. So all of those critical needs are being met. And a lot of times that's done, of course, through our community-based organizations and nonprofits. As a member of the Ohio Workforce Coalition, which I became a member while I was leading a nonprofit called Perscolas, where we did technology training, certification, and job placement, I definitely support the coalition's policies and priorities. And I see us as a partner to support the work that you all are doing in the community and helping to ensure that we get the impact that we desire. Next slide, please. So who we serve in Unite Ohio, we serve community-based organizations. We work with our hospital systems and managed care organizations. and certainly community health initiatives and all of the initiatives that are happening in the community. So I like to see us as helping to support this ecosystem that we all desire to create, where we can talk to one another and collaborate and make sure that we are providing true wraparound services for individuals as they move forward. We care about a workforce development because we know that as we put these investments in to supporting and driving results for individuals who are working to better their lives and build out their skills and everything, we can better support them by making sure that they don't have to worry about certain things, that we can make sure that they can get what they need in order to move forward. So we care about workforce development because economic mobility is important for all of our Ohioans, and we want to make sure that we are the backbone that supports helping that happen. Next slide, please. So when you think about the Unite Us platform and data and all of the different things that are out there, we know that it's really important to have data with integrity so that we can make some informed decisions. And in thinking through, and I've had several conversations with my colleagues at the Workforce Coalition and others around how do we really get that data, and how can we be assured that all of our organizations are set up for success when it comes to collecting that data and actually then bringing it together in an aggregated way so that we can kind of unpack it to make some real-time decisions. So we want to know what types of services are Ohioans receiving? What do they need? How are those needs presenting at our different organizations, or whether or not there are non-emergency needs that come about that are discovered when an individual accesses the emergency rooms or urgent care centers and they say, you know, my challenge is actually this, which is what's driving my stress level, or what's driving the aggravated conditions that I'm having. It could be I'm food insecure, rent insecure. I don't have a job that covers all of my needs. And so being able to, at whatever point you meet that individual, being able to connect them to the support that's going to resolve that issue and challenge for them, that only makes it better when we talk about preparing individuals for the jobs of today and tomorrow. We believe that, you know, investing our state dollars into not only ensuring that training programs are fortified and individuals have what they need to sustain themselves while they're in training, we also want to fortify what we have in terms of how we support individuals moving through the process. And so our goal is to make sure that we help provide data, that data then has integrity, and you have the way to present it back to whether it's our community, it's our organizations, it's our leaders, to say, this is the data that we've been able to collect as we engage. And now let's look at gaps. Let's look at where resources need to be redirected. Let's look at what needs are truly presenting so that we can be assured that we're able to redirect and serve the needs that are presented to us as they come through. So I'm just excited to be a part of this conversation. Look forward to continuing the conversation across the state and figuring out how we can support your efforts and ensure that we are preparing people for the jobs, not only of today, but of tomorrow as well. So thank you for your time.
Thank you, Tony. We'll move on now to Elizabeth with Vibrant Ohio.
Hi, everyone. Welcome. I just want to see, is Brian on with us? Just me?
He is.
Hey, so Brian
Elizabeth
is here.
and Brian.
Thank you. Brian is here with me. Brian Wright from Cincinnati Compass, and I'm Elizabeth Kuzma from Global Cleveland. And together we both we are two of the organizations that form Vibrant Ohio. You can see we're Cincinnati, Cleveland, Columbus, Akron, TLC, Bowling Green, and Dayton. So we are a coalition of immigration integration groups across the city. And a large part of what we do is around economic development and workforce efforts. Next slide. So who do we serve? Well, we serve immigrants, as well as Blacks and Latinos, all of whom are disproportionately affected by public health crisis. So we serve whether they are secondary migrants having moved from a different city, initial, migrants moving directly to any one of our cities in Ohio, international students, people here on non-immigrant work visas, really a whole slew. They see one of us throughout the state, at some point. So we really have a good idea of what is going on in the newcomer communities across the state. And we work very well together at bringing, issues that affect all of us to the statewide level. We believe that ARPA dollars should be used to impact those who are most impacted, which tend to be communities of color and immigrants. Brian, you want to take the next part?
Sure. So,
can you go back? Sorry.
Yeah.
Thanks.
Why do we care about workforce? We care about workforce because immigrant refugees are residents of the state of Ohio and are, as Elizabeth mentioned, Black and Latino and immigrant communities tend to be the most impacted by the pandemic. And as we know, with demographic shifts in the state of Ohio, where we have an aging workforce, where we're looking to replace the workforce, and immigrants and refugees moving are often the drivers of population growth and also have higher rates of working age community members. So we see it important as workforce in that area to help address the demographic shifts. Also, we know that immigrants and refugees and newcomers are drivers for Main Street business growth, as well as the drivers of frontline workers and essential workers, and tend to be in those frontline or essential roles at a higher rate than the native-born Americans. And so we would like to see, the funds be allocated to a lot of those frontline and essential workers. Next slide.
So key priorities for investment. We think that the allocations of funds need to be done regardless of immigration status. So it should not matter what your status is as an Ohio resident. The fact that you live in Ohio should be good enough. We all agree that we should increase the SNAP and EBT and childcare benefits. Many families do use benefits. They also use it for a much shorter time than native-born American families. And so to deny or to not give an appropriate amount of benefits to these families, really hurts everybody across the state. So we think that there should be an increase in those benefits. We also think that there should be premium pay raises for essential workers making less than $15 an hour, ideally, $20 an hour, because 15 still really isn't enough to live on. But we definitely think that you need to be making at least $15 an hour. And I really appreciated what was said by the first speaker today. There are a lot of needs in the immigrant community that can be serviced and that are being serviced by some of these wraparound organizations that really support their ability to get to work. So I appreciate what Unite Us is doing. Also, we think that there should be cultural, linguistic, and IT training and adaptation of training programs for upskilling or reskilling. We know a lot of these programs exist. The question is, do they exist in a way that can be accessed by immigrants and ESL speakers across the state? We want to make sure that all of those programs can be accessed by this population. And we want to scale up affordable housing and expand public transportation because A, there's a lack of affordable public housing or of housing, and B, a lot of the public transport does not get people from where they live to where the jobs are. Next slide. Brian, you want to take this?
Sure. And so when we're looking at budget and funding asks, and sort of there's not necessarily a specific dollar amount, but as Elizabeth mentioned, we want to make sure that funds are allocated in an equitable way and in an accessible way, so that we want to make sure that regardless of immigration status, that folks have access, particularly when folks are working and contributing to the tax base across the state of Ohio and drivers of the economy. We think it's imperative to follow an adequate funding model. And what we mean by that is adequate funding, not a across the board dollar amount per individual, but looking at what is adequate to make sure that workforce needs to be met. And so not only looking at specific IT training and pathways for careers, but as the previous presenter mentioned, is looking at those supportive services around employment, whether it's housing, transportation, looking at SAP and EBT and other kinds of support, so that look at the full individual and human experience as the employer. And if we see that money is not allocated, then that's a large portion of the workforce that is not addressed or doesn't have access to additional services. And folks that make up large portions of essential worker and frontline staff. Businesses are not able to reopen or to relaunch or even grow. And it makes it harder. And as we know, as immigrants and refugees are business owners, they're also employers. And so not having access to these resources, it makes it challenging to be able to grow their businesses and help fill the jobs. And so it just exacerbates the exodus, particularly in the healthcare sector.
Mm-hmm. So, whatever happens to the general population in Ohio happens in a more acute way to immigrants in Ohio. So just to make sure that everyone is really thinking about how do these funds impact workers, and specifically how do they impact workers who English is not their first language or who have different immigration statuses. So we appreciate your time, and we're happy to go into any more of this in depth later on. You have our contact information. Thank you.
Thank you.
Thank you. And next up, Grace Heffernan, representing the Northeast Ohio Worker Center.
Hey, greetings, everyone. Thanks so much for having me, Rebecca. And I have so enjoyed hearing from the previous presenters. So I'm Grace Heffernan. I am here as a member of the Northeast Ohio Worker Center. For those of you who are not familiar, worker centers they're like a union for people without unions. They are places that work to advocate for and build power for workers. And we are lucky here in Ohio to have a network of worker centers. So I'm speaking today on behalf of the Northeast Ohio Worker Center, but there is a worker center based in Columbus called the Central Ohio Worker Center. And there is a worker center in Cincinnati called the Cincinnati Interfaith Worker Center. And so I thought I would kick off today with a quote from a recent report by the National Fund for Workforce Solutions. I don't know about you all, but I gobble up whatever they put out as soon as they put it out. And this has really been a light bulb moment for me. This idea that for every good job available today, there are about 50 workers in need of good jobs. And they define good jobs as jobs with family sustaining wages, consistent scheduling, and not being in risk of being automated away within the next 10 years. And so what that says to me is that traditional workforce development practices such as upskilling, reskilling, technical training, career readiness are all very, very much so important. And also we have to be thinking about how we raise the floor for all jobs. Because even if we fully funded all of the skilling and upskilling that we would like and had all of the dollars to get folks into the good jobs that we know exist in our community, there would be many, many folks left behind. And the pandemic really, I think, illustrated that to us, right? There is not a scenario where the service industry, where home health, where retail just goes away or ceases to exist. Those jobs are a huge parts of our economy and are the ways in which many Ohioans take care of their families. So next slide. Our key priorities for investment are, they're actually based off of a recent report by Policy Matters Ohio. So if you'd like more detail, you can check them out there. But the first, and this very much echoes the folks from Vibrant Ohio, is premium pay for essential workers. So we, as a part of ARP, can provide essential workers with retroactive back pay or hazard pay. I think there's a real audaciousness to calling essential workers heroes during the pandemic and not monetarily rewarding them for those efforts. And so that's one area for investment. The second area for investment, I'm going to skip down to the third bullet, is a legal defense fund for workers. So right now, if you're a victim of wage theft, if you're being treated unfairly in the workplace, if you need any sort of legal representation that has to do with the workplace, you have very little recourse in our communities. I can tell you that in Cleveland at least, you can either go through legal aid, and they have a small labor department, very small, or you might be able to go through one of our workforce development programs, but only a few of those actually have lawyers on staff. And so there is a huge need for access to legal aid in our communities for workers. And so then the third area, and this is an area where we are actively organizing, and if you are intrigued by this and would like to learn more, I would invite you to check out our website, Guardians for Fair Work. We know that wage theft and fair scheduling are huge issues. Wage theft right now, I can tell you, if you were to combine all of the property theft, grand theft auto, larceny, and other types of sort of like physical theft that you think of, if you were to combine those all up, they would still be dwarfed by the amount of wage theft that takes place in Ohio each year for workers. And there's only 5 wage theft investigators for the entire state, and that's just not enough. And so we are organizing around wage theft, and we are also organizing around fair scheduling. We would love to see in our communities hourly workers being able to have a sense for where their money's going to be coming from in the next month, and that really helps them to prepare not just to be successful on the jobs, but also outside of the job. And so again, yeah, if you're interested in learning more about that, please visit Guardians for Fair Work. And next slide. Okay, so I'm actually seeing what some of the other panelists did, which was to sort of sidestep this question. So suffice to say, I don't know exactly what all of these things would cost, but I did do some estimates. They're really back of the napkin estimates. So I do know hazard pay for essential workers, that is written into ARP legislation. We could do that today. ARP allows for up to $25,000 of premium pay for frontline workers, and that can be paid retroactively. And when we talk about the impact that could have in people's lives, that's a 401k account, that's a car to get to work, that is a deposit on a home, that's a deposit for a college education. That's like serious money, and that's life-changing money for families that our essential workers are very much in need of. Another ask is around increased labor enforcement. So when I was talking about wage theft and fair scheduling, there actually are some laws on the books that regulate those things. We just have absolutely no enforcement mechanism in many of our communities. And so this would be about creating and sustaining a local labor office. Typically, they're called like labor and wage standard offices. Some communities do have them, not all. And then finally, a legal defense fund for workers. Cincinnati recently proposed a citywide defense fund for workers with an initial investment of about $2 million. And so those are just some of the figures that we could start to think about how to bring these things to life. And then next slide. So what happens if we don't allocate this money? What happens if we do not start thinking about workforce development as sort of like this yes and strategy? Yes, we need training. Yes, we need upskilling. And also we have to be creating better jobs, and we have to be creating opportunity in industries that I think we typically write off as not good jobs. So I'm talking about retail, service, home health. There will be major ramifications for workers, and businesses will continue to not have a pipeline of the talent that they need. So that's it. Thanks so much.
Thank you, Grace. Next up, we have Alex with the Ohio Council for Home Care and Hospice.
Thank you very much. And this is actually a very timely conversation following our previous presenter. So thank you for talking about some of the home health workforce. And we're going to be touching on that today. I also have with me my executive director, Joe Russell, to help me conduct this presentation. So I will give a quick overview and he can go into a little bit more details about some of the funding that we hope to see. Next slide, please. So the Ohio Council for Home Care and Hospice is a nonprofit provider trade association. We represent home care and hospice agencies that take care of people from birth to death. It ranges a variety of payer sources from DODD, mental health addiction services, behavioral health, veteran services, so on and so forth. And the goal is to keep people living comfortably in the comfort of their own homes. Our workforce is a little unique in the sense of our agencies employ home health aides, STNAs, CNAs, occupational therapists, speech language pathologists, RNs, LPNs, so on and so forth. Next slide, please. Joe, do you want to talk a little bit about the reduction in revenue and increased wages that we've seen during the COVID-19 pandemic?
I would love to. Thank you, Alex. Since April of 2019, we have seen a significant reduction in monthly revenues and gross margins. We've seen a reduction of 25%. And at the same time that the demand for community-based services has skyrocketed with more and more people wanting to avoid institutionalization. But at the same time, we've had to increase our wages an average of 13%. And of course, we've had a significant increase in the cost of doing business with PPE and other things. So the cost of doing business has gone up significantly. And that 13% increase in wages is only to try to continue to compete with the private marketplace for certain sectors of our workforce. And I think what pervades our thoughts on ARPA is the short time frame for the EFMAP. It means that we really need to think about getting these dollars out to providers immediately, and we cannot wait any longer. Really, these dollars we needed them yesterday. So any wait and hold in period of time is just more and more people who can't be served. Next slide, please. So agencies that serve Medicare and Medicaid are shifting their resources away from Medicaid because they're losing money on every single visit they provide. On average, we're seeing visits cost about $120 to $125 per visit, and Medicaid reimbursement doesn't even get close to that. If you are a passport only provider, we're seeing those agencies close their doors every single day, and we're seeing a shift away from Medicaid. And this is a crowd out situation where people are not being able to access the care they need. We know that the state government, the administration is aware of these issues as the waiting list continues to grow. More and more people are going without care. And agencies can't expand their operations, even though they want to, because they can't hire the providers to sustain their programs. It's not a free market in healthcare, at least in the Medicaid space. And so we can't increase wages if we can't increase payments. We can't just increase our prices to match the market wage, and that's a huge problem for us. We recognize and we thank the work that was done through the budget for the 6.1% increase, but quite frankly, the difference between when those increases last took place and today, the 6.1% increase does very little to stop the jettison that's taking place in the community. So it's very clear in the federal legislation what these dollars are to be used for. And because there's such a gigantic workforce shortage in home care, hospice, but really all across healthcare, we really think these dollars need to be prioritized for people, not programs. There's a lot of great ideas out here. There's a lot of, but at the end of the day, if we don't have people to provide services, it doesn't matter how great the programs are funded. Next slide, please. So obviously, I'm sure you guys have all read ARPA, or at least familiar with the concepts, and it is the money for the EF map for home and community-based services is intended to enhance, expand, and strengthen home and community-based services. In the administration's proposal, we've got some. We understand that there's a lot of different varying wants and a lot of different varying needs that have to be addressed, and there's a lot of good ways to spend money. But we're really concerned in the proposal that exists today that some of these fundings don't qualify for these dollars, and quite frankly might be inappropriate to include there. Some are administrative funding, and others don't really, or not traditionally anyway, receive federal match. I think those are big problems. Again, the workforce issue is so clear that we need to, it's an emergency, and we need to allocate as much funding as possible to getting people out there to be able to serve. Yeah, so we need to train more people. We need to get more providers out there. It's just so critically important. Next slide, please. Workforce is the lifeblood of HCBS. Without the people, it doesn't exist. We have to drive to every person's house. If there's no person to drive that car doesn't drive, and there's no person to provide the care. So it's so critical to get people, and so we're kind of doing our due diligence to engage the right folks, and we hope that the administration can take into consideration the most immediate needs, and again look at funding people, not programs. The last thing I'll say, and I'll turn it over, is there's a couple things we'd like to see through ARPA no matter what happens. We'd like to see a clear and transparent formula for how these dollars are going to be allocated. We think it's really important that it's equitable, whatever the decisions are, and that we can calculate what provider payments should look like. The second thing is that we absolutely positively believe these dollars need to be prioritized for HCBS providers. Any dollars that go to non-HCBS providers is inappropriate in our mind. And the last thing is we'd like to see it happen very quickly. We know that there's a process that has to take place, and this is part of that process, but it's so critical that we get those dollars out there as soon as absolutely possible. So thank you, Alice, and thank you, everyone. Appreciate your time, and I'll turn it over.
Thank you.
Thank you. And up next, we have Thanapat representing the Workforce Innovation Center at the Greater Cincinnati Chamber of Commerce.
Great, thanks, Rebecca. Good afternoon, all. My name is Thanapat Vichachat. I'm the Senior Project Manager for the Workforce Innovation Center. I appreciate the opportunity to speak with you today about our work with employers and on the broader subject of job quality. Too many working people have poor quality jobs. The Brookings Institution reports that 44% of workers, more than 53 million people, earn low hourly wages. Research at Gallup finds that only 40% of Americans believe that they have a good job. At the recent interagency convening on equitable economic growth, Deputy Secretary of Commerce Don Graves recently stated, "A competitive and equitable economy runs on good jobs. When diverse workers, families, and communities thrive, the American economy thrives." To share some history about our city of Cincinnati and our organizational roots, about 6 years ago, Cincinnati was number 2 in the nation in childhood poverty. Due to this, the Childhood Poverty Collaborative was formed, where various stakeholders in our community came together to address the serious issue. Not surprisingly, children are not poor in a vacuum. They're poor because their families are poor, and their families are poor because they are unemployed, underemployed, or overemployed, meaning they need to work multiple jobs to make ends meet. An employer roundtable was convened, which sought to engage companies to fight in the fight to reduce poverty. It was known that employers are and can be a catalyst for economic mobility, and there was a business case for innovation. Ultimately, feedback from employers communicated a need for a more action-oriented approach. This led to the launch of the Workforce Innovation Center within the Cincinnati USA Regional Chamber in 2019. Next slide. The Workforce Innovation Center is a talent consulting practice to help employers improve their workplace practices for the benefit of their businesses and their employees. We are working with employers in the greater Cincinnati region, but can work with employers anywhere. We meet employers where they are, and through our in-depth interview and survey of leadership, we hear about companies' goals, challenges, and existing practices. Next slide. We offer 3 main services to help employers better understand their current state: an employee survey, a policy and practice review, and workforce analysis. Our services can provide meaningful data to allow companies to make informed decisions to better their workplaces. As a third-party provider, our comprehensive employee survey helps lift worker voice across a variety of professional and personal domains. We are able to analyze survey respondents' answers by role, wage, or demographics to highlight disparities that may exist and provide this to an employer in an unidentified way. The analysis of workforce can highlight gender or racial disparities in earnings, retention, and job growth. And our policy and practice review can uncover gaps in policies while providing benchmarking in areas like capture rate and readability. After this discovery phase, our consultants analyze this data utilizing their expertise, along with our proprietary web platform of evidence-based practice recommendations to come up with customized solutions for employers. These recommendations also include pertinent connections to our network of partners that assist to provide additional solutions for companies. Additional project management and engagements are available should a company want additional support with implementation and beyond. Next slide, please. So you may be wondering, why do companies engage with the Workforce Innovation Center? Companies have worked with us for a variety of reasons: to become more diverse, equitable, inclusive, to identify new sources of talent, to increase retention, or to benchmark against industry peers. No matter what the reason, we are working with employers that want to adopt new inclusive workplace practices, provide quality jobs, and become destination employers. Next slide, please. We have over 150 evidence-based practice recommendations across 11 practice areas. 4 of those practice areas are listed here. Some of the themes from the broad practice areas can be found in national job quality frameworks such as the Aspen Institute. The Workforce Innovation Center is also working to bridge the private and public sectors through our partner recommendations and connections. The feedback we've received from employers is that the nonprofit ecosystem is confusing and hard to navigate. We're working to make this easier for employers. Some of our partners are shown here. We convene partners quarterly and continue to grow our regional partner network. We often refer to our community partners as social solution providers for the various solutions they can provide to employers and their employees. Some examples of recommendations and connections to client employers include CARES Act dollars for employees who have expressed housing insecurity through our employee survey, and organizations like Cincinnati Compass, which can help connect immigrant and refugee populations as a new source of talent. Employers are the end customer for mostly all stakeholders in our workforce development ecosystem. However, they're not always the primary customer. Employers are our primary customer, and we provide a unique approach to meet them where they are and help them adopt inclusive practices. These practices ultimately improve job quality and create a positive ripple effect through their employees and thereby the community. So far this year, 14 employers have received 163 practice recommendations, of which 10 employers have committed to adopting 37 inclusive practices. Employers are implementing a range of 1 to 16 practices each, and employers are working with local providers to hire talent and solve issues. To share a quote from a client employer, "The center provides a structure and discipline to provide meaningful change, and we hope that as we continue to make strides, we can inspire others to do the same." It is our hope that the state will consider allocating resources to, number 1, support organizations that can help impact job quality initiatives, like lifting worker voice or provide technical assistance to employers. Number 2, support organizations that can connect public and private sector to work more collaboratively. And number 3, invest in benchmarking tools. If you don't consider investments in job quality, you will still have inequitable systems, which will continue to keep people from being economically stable and economically mobile, and a continued disconnect between the public and private sector. I appreciate your consideration for organizations like ours and others presenting today.
Thank you. And we will now move on to Kathy Belk with the Deaconess Foundation.
Hi, everybody. Thanks for the opportunity today. I'm Kathy Belk. In my day job, I'm the president and CEO of the Deaconess Foundation, which is a small private foundation in the Northeast Ohio, or Northeast area of Ohio. I am here today in the function as the chair of the Workforce Funders Group. This is a public-private philanthropic partnership of funders. You can see the members below, who include our Ohio Means Jobs office, the City of Cleveland and Cuyahoga County, as well as several of our foundations and corporate partners. And I'm here today to talk about how we can accelerate job placement and success through expanding sector partnerships. So next slide, please. So what is a sector partnership? You know, this is a proven methodology for helping Ohioans get to work and our Ohio employers to employ people. It's been supported by the Governor's Office of Workforce Transformation, but just in case this model is not familiar to you, I'm going to go through it quickly. First of all, many of the problems in the workforce system have occurred because support partners, the different people who train our talent, our Ohioans who are talented, the people who train them listed here on the left, they have in the past been training people without any visibility to the jobs that were open. So people would be trained and available to work, but not in the jobs that our employers have. Sector partnerships take that model and turn it on its head, which is they start with our Ohio employers. And employers in the same sector. A sector is manufacturing or IT or healthcare or hospitality. They get together, they collaborate to identify their common workforce needs. And then those needs are shared back with the organizations who we call here support partners, universities or community colleges, nonprofits, so that as they're preparing job seekers, they're preparing them for the jobs that we have today. And these discussions that we talk about here, when I say employers are telling the support partners, those are actually facilitated by an organization. Here it's called a trusted convener. It can be a nonprofit, it can be a chamber of commerce, it can be a community college. It's whoever is a trusted neutral party in a community. And as I mentioned, this is a proven model that our state has already supported. Next page, please. So why has our state already supported this? Why have these been successful? So the first thing is that it's an accepted model by employers. It's actually been shown employers see that it is valuable for them to participate in these initiatives and they're able to fill their open roles. It also really encourages job seekers, Ohio citizens who are seeking jobs, to work in our state's most important industries that support family sustaining wages. This gives them great visibility as to how they can progress on a career path and earn a good income, a living wage for their family. It's already worked. I mean, why do people like it? Because it's already been working. At the same time, obviously, we have greater need now than maybe we've ever had in our history, both on the employer front and with the number of job seekers who are out there who need something different, maybe than what's been offered. There's three other things I'd like to highlight in terms of why this model has been so exciting and successful. It's increased the diversity of individuals who are successfully trained and placed into jobs, including those who have been difficult to place in the past, reentry individuals being one example of those. Secondly, it's really increased the visibility of the needs of workers. This table, this neutral convener who brings together workers and employers are able to provide more visibility as to what workers really need. What are the things in a job that might impact job design that employers haven't either been listening to or didn't know in the past? And to this last bullet on the page, when employers understand what workers really need to be successful, they're changing their practices. Employers are very open to those changes. This gives them a way to do that. So this is why this is a model that has been working and is successful. Next slide, please. I'm not going to dwell on this other than to say that some of Ohio's most successful employers are involved with sector partnerships. You see, this is a list of those just in the Northeast Ohio area who have been involved, but we have sector partnerships all over the state. And I think you would see that employers wouldn't be involved if they didn't really see real value in this. Next slide, please. So this is my last slide, and I'd like to offer you some ideas for investment on how we can get many more Ohio citizens back to work and fill the needs of our employers. The first idea is putting $30 million to work to scale existing sector partnerships. And this would impact 20,000 Ohioans. There's two different kinds of sector partnerships that exist and that the state's already been supporting. One is those that are mature. I would call them mature. They've got well-engaged employers, they have infrastructure in place, and they have the attention and the partnership with the talent developer nonprofits. But clearly our state's in a different position now, and we need to do more of that. We need to engage with more employers, and we need to engage with more job seekers. There are also emerging sector partnerships in sectors that have been changed since the pandemic started and are in different situations that they were 2 years ago. Hospitality is a great example. And I know in the greater Cleveland area, there's just the beginnings of a hospitality sector partnership right now. This funding could really transform the scale that these existing initiatives have. And two other things to comment on this. The first is that you've already got a great structure, which includes matching funds. So state monies are actually matched by private sector money as well, creating even more impact. And we've already seen that how those state dollars can fill some of the gaps that exist in the system, like additional programming, like job coaches, like stipends for those who are attending training, so that you can actually move out of the job you have, if it is a low-paying job, and attend training so you can be upskilled. The second idea is $40 million for flexible supportive services and emergency loan funds for use by those 20,000 Ohioans who are going to be trained and ready for jobs through the sector partnerships. Today, that's about $2,000 a person. And today, those kinds of supportive services dollars are often available through the Ohio Means Jobs office at that amount. So this is just a matter of making more funding available for all these additional people who we want to get engaged in our most important industries in the state. And we do know from research that when people start training, if they don't have these kinds of flexible supportive services, if they don't have a job coach, if they don't have coordinated, comprehensive support, they are 4 times less likely to finish that training. So we don't want to leave that investment on the table. We want to make sure that people are successful and get to work. Thank you for your consideration.
Thank you, Kathy. Next up, we have Lori McKnight representing Workforce Area 14 down in Southeastern Ohio. Are you with us, Lori? We might have to come back to Lori. Let's go ahead and advance and move to Sarah with MetroHealth's Nurse Family Partners Program.
Good afternoon. My name is Sarah Biedenbach. I'm a nurse home visitor with the MetroHealth Nurse Family Partnership. I'm going to come at this from a little bit different perspective. We are a program that serves low-income moms from early in their pregnancy until their children turn 2. We provide a free in-home personal nurse for these women. And one of the main goals for our program is to help our clients become self-sufficient. Well, as you can tell, when these women have these children, they need childcare. Next slide, please. Childcare funding is essential because work is a gateway out of poverty. The women we serve are, at or below the poverty level. We need them to get back to work in order to help them become self-sufficient. By helping them gain access to childcare funding, it gives parents time to work, and it gives kids that educational opportunity that they need in order to succeed. Higher household incomes are also associated with better educational outcomes and reduced stress of poverty for children. Next slide, please. Some of the barriers that we have seen that our clients report to us is that there is no childcare available for interviews. So even though these moms want to get back to work, they're not always able to because, you know, they don't even have the time or the ability to get to interviews without someone to watch their children. The process of getting childcare for these women can also be very difficult. Our clients report to us that, you know, they aren't able to receive any kind of vouchers for childcare without proof of employment. It's really hard to get a job without the childcare, but then they can't get the childcare without the employment. You know, paying out of pocket until their vouchers are approved. If we were able to just assume eligibility for these women until till their vouchers were approved, they would have access to childcare without having to pay out of pocket. You know, and with adequate childcare, without adequate childcare, parents are not able to work or advance in their careers, which, you know, leads to less people in the workforce. So our ask is that, you know, there's better funding for these state-approved childcare programs, and that there is easier access for these women to be able to receive their vouchers or to receive assistance for them to be able to have interviews, to get these jobs, and to be able to move forward and make themselves self-sufficient. And because that is one of the goals of our program, that we would like them to be able to get to that point. And that's all I have today. Thank you.
Thank you very much. It's great to hear the perspective of one of our hospital systems and programs there. We are going to move on and hear from Jack Hershey, President and CEO of the Ohio Association of Community Colleges.
Good afternoon. I am Jack Hershey. We represent the state's 23 public community colleges located all over the state. I'll start with saying that in times of high unemployment, community colleges usually see a 15 to 20% increase in enrollment as people come back to retool. That is not what we have seen during the pandemic. We've actually seen our enrollment drop during the pandemic. And so it's really forced us to focus our views on what's happening out there. There's three major things we're focusing on. I'll talk mostly about one of them, but I'll give you a highlight of the other two. The first is employer partnerships. You know, right now we are losing students because they are choosing to work in many cases, especially those in hourly wage jobs that have seen significant increases in pay over the last year or so. And we certainly understand that decision on their part, but we also recognize it has long-term impacts, both for their own career development and the long-term needs of Ohio employers. And we believe there are models out there for businesses and organizations who have room in their organizational chart for advancement to better support college students. The second we see is the overall cost of attending college. You know, while the free community college proposal out of the Biden administration is not moving forward, the reality is that free college programs are already here in Ohio and they are working. The ones in Ohio tend to be more targeted and focused, but they are impactful. Of our members, Edison State, North Central State, Stark State, and just recently announced Columbus State have all rolled out scholarship programs that have worked. And those colleges are showing better enrollment trends during COVID than the schools that have not implemented them. And these more focused programs in our mind are cheaper to implement than most people think, and they can be done much more affordably than the proposal that Congress ultimately did not move forward with. So the real one that we're focusing on for the federal funds are what we view as capital and equipment barriers, those instances where one-time projects related to capital facilities and equipments, we believe can provide long-term workforce solutions in certain industries and areas. Our colleges have been meeting with multiple groups of employers in their service area over the last several months to a year to identify solutions, all sorts of solutions really to the current workforce shortage. And we've asked them to specifically identify areas where a lack of capital facilities or outdated facilities are perceived as a barrier to more individuals being trained, both by employers and the community as a whole. So I apologize for not having slides. We're not officially, I'm not officially approved to talk about our list yet, but I'm going to give you an example without a name, just so you get a sense of this. One of our colleges has been meeting with manufacturing employers in the area for about a year to specifically discuss the ability to expand their additive manufacturing and welding programs, both in terms of the overall capacity, but also in terms of program design and how to allow students to complete those programs quicker than has been in the case or in the past. That college has a proposal now that would add the space that both they and the local employers believe are necessary. And so far, they have more than 70 local employers who have attached their name to a request for funding, so that the state knows that we aren't just dreaming up projects because there's money on the table. In fact, every project that makes our list will have been vetted and endorsed as desperately needed by Ohio employers in the area. In addition, we will have projects on our list that in our mind fulfill the capital needs of our colleges in order to expand programming and workforce training options that are in direct response to really the good work that's been done by the governor, lieutenant governor, and Jobs Ohio to attract new companies and facilities to Ohio. So we are in the final stages of assembling all of these projects, and we hope to have that available to share with public officials within the next couple of weeks. Thank you.
Thank you, Jack. We will move on to Lori Atkins, representing the Literacy Cooperative of Greater Cleveland.
Good afternoon. My name is Lori Atkins. I'm the Vice President of Strategic Initiatives at the Literacy Cooperative in Cleveland, Ohio. Our mission is to work to advance literacy by raising awareness of the issue, promoting effective public advocacy, and fostering a delivery system with maximum impact on the region. We do this through convening our partners, championing awareness of low literacy, and identifying strategies to connect adults with low skills to literacy and career pathways for better employment opportunities. Now more than ever, we need to re-engage our community services that will prepare families for a world beyond the pandemic. Education and training are proven solutions to a path out of poverty. However, the literacy cycle perpetuates low literacy levels, which affect important stages in education. Research continues to prove that children unprepared for kindergarten are less likely to read proficiently by the end of third grade, a predictor of later success in school. And adults without a high school diploma lack the basic literacy and other skills required to access in-demand jobs that offer pathways to prosperity. Next slide, please. Addressing the needs of adults and children should include concurrent approaches that provide equity and flexibility to parents and caregivers so they are not making sacrifices. We are seeing too many adults canceling plans for post-secondary education, as just indicated by Jack. A recent report from the Center for Community Solutions cited that as many as 170,000 Ohio women canceled all plans to take post-secondary classes in this past term, compared to 17,000 men. Whole family strategies, also known as 2Gen, create a family-centered, highly positive service delivery system that seeks to reorder traditional ways that programs serve families. The result focuses on partner development and coordination to modify the service delivery of existing programs to better connect adults to career pathway opportunities and to connect early childhood and adult providers to coordinated learning strategies. Based on a successful model developed in Maryland, Ohio should create a 2Gen Family Economic Security Commission to investigate policies to address multi-generational economic instability and poverty, identify state services and policies that can be coordinated or braided, and identify tools to measure and predict the impact of the benefit cliff. Most importantly, the commission would develop and use measures that identify the impact of 2Gen programs. Today's job market is rapidly changing, and the way in which workers adapt adapted their skills in the past are unlikely to be as effective now due to the quickly evolving nature of work and the increased productivity, technology, and flexibility required in most jobs. According to the National Skills Coalition, 54% of in-demand jobs in Ohio require training beyond high school, but not a four-year degree. However, 54% of adults are not proficient in literacy, and 64% are not proficient in numeracy, and 1 in 4 are operating at the lowest level of digital skills. Therefore, even with access to training, adults may struggle due to less than proficient foundational basic skills. Government, industries, and higher education are planning how to prepare workers for the future, and foundational skills must be included in the conversation. The Ohio Department of Higher Education's Aspire funding currently funds opportunities for integrated education and training. IETs combine basic skills education with job skills training to better prepare adults for career pathway opportunities with economic mobility. Currently, 28 of the 52 Aspire-funded providers offer IET, and adults are interested in this model because it contextualizes basic skills to the occupations they are trained for and most interested in obtaining employment. This type of training provides a more inclusive, equitable learning environment. There is an opportunity to include this type of instruction as eligible training programs through the state's workforce inventory of education and training. Next slide, please. The Literacy Cooperative is suggesting that $1.5 million in funding is set aside to create a statewide 2-gen commission led by a statewide 2-gen director. The commission should include state directors from the Ohio Department of Employment, of Education, Higher Education, Ohio Office of Workforce Development, and the Ohio Department of Job and Family Services. It should also include representatives from early education, K-12, post-secondary, adult education, workforce development, and supportive services, and most importantly, families currently receiving services through state agencies. In addition, $3 million should be allotted to the Ohio Department of Higher Education's Aspire to increase funding for IET programs through all Aspire programs. Providers equipped to provide IET options should also be considered for funding for the eligible training programs that are funded as individual training accounts through Ohio Means Jobs offices. There is a need to provide technical assistance on adding these type of programs and providers to the workforce inventory of education and training system. Next slide, please. No funding equals no changes. We will continue to see these same statistics or worse. Thank you for your time and consideration.
Thank you, Lori. And we are going to go back to hear from Lori McKnight, who has joined us now. Lori, the other Lori, I say.
Absolutely. Thank you, Rebecca. So my name is Lori McKnight, and I'm here as the director for Area 14. So in Ohio, there are 20 workforce areas in the state. Area 14 covers the Ohio Means Job Center for Athens, Meigs, and Perry counties, which provides services to job seekers, workers, and employers by offering career services, resume and interviewing, training or upskilling services for both job seekers and employers, resume mining, and job postings for employers. All this is provided for free. So Area 14 and many other Appalachian counties don't get the same attention as our bigger counterparts due to their population size. We'd love to see greater collaboration among our partners to deliver services in a coordinated fashion that will allow for more supportive services for our participants and our businesses, and an increased focus on job quality to help people gain and keep jobs that allow them to be self-sufficient. Next slide, please. We are here to serve both adults and youth, as well as employers, our local businesses. WIOA is one of the greatest investments of federal money for workforce. And as a board, we work across providers and other stakeholders to deploy these funds. When we do that in collaboration and connection with others, we get more out of that funding that's provided to both employers as well as participants. So people across the region want to work and they want to be able to support their families and need a range of supports in order to be able to do so. The supportive services that we can provide people in order to receive training and upskilling are vital to these people, especially in our Appalachian counties, which are usually lower income, and the employers are usually paying less than or just above minimum wage. So businesses are eager to hire, and it's our goal and our job to supply them with a trained workforce. Next slide, please. Some of our key priorities are obviously the expansion of affordable broadband. So our work in collaboration with Tri-County, the Governor's Office of Workforce Transformation on the fiber optic program is amazing. So we developed a 6.5-week program that allows you to graduate with a certification or complete a certification and lay line, which is extremely important. We're going to be receiving a lot of broadband funding, hopefully in the next couple of years, and jobs within that broadband and fiber optic are amazing. For 6.5 weeks at about $900, or if you're low income or on unemployment, you can actually receive that free through WIOA services at your Ohio Means Job Center. You will graduate with a job offer almost immediately, according to some of the businesses that I've spoken to, starting out at $18 to $20 up to $23 an hour, which is amazing. They're also willing to make this a pre-apprenticeship to an apprenticeship program, which means that they will continue to train you and upskill you in jobs that will result or can result in 6 figures with little to no either a high school diploma or a GED. I've also been told by some of the employers that a GED isn't even required, which is amazing. So our hope is obviously to expand on remote work possibilities as well. So I'm working with the Mayor Steve Patterson in Athens about looking into renovating the Armory in Athens and adding childcare on site or nearby in order to have remote work possibilities. We're also looking to develop something out, or they're looking to develop something out like that in Gloucester as well, and possibly expanding it into Nelsonville as also. So by increasing apprenticeship and by developing out our pre-apprenticeship programs with our area career centers and community college, so that we can allow our youth entry straight from high school into good paying jobs. So our goal is to provide a strong focus on training by working with our centers and our colleges alongside our employers. Next slide, please. Why is this so important? It's important that our funding for WIOA continues so that we can continue to upskill people and get them jobs and in-demand careers that are going to allow for them to have self-sufficient wages for both themselves and their families. That our investments with ARPA funds help to support frontline workers along with the businesses so that those businesses can stay open and expand, especially in Appalachian counties. At that, we look at these funding strengths strategically to allow for coordination and collaboration with partners to provide for the workforce needs that are in front of us. It's going to take all of us to get through this pandemic and to survive, but not only to survive, but to expand. And I think that we have the opportunity now to really sit back and take a look at how we're going to be doing this. Thank you.
Thank you, Lori, and thank you to all of our panelists as well as individuals in the audience today. I'm happy we do have some time, so I'm happy to open it up for questions. If you'd like, not all of our speakers were able to stay on for the full time. As I mentioned, if you do enter questions into the chat, we will be following up with everyone to get answers to those questions and to make sure that the recording and those answers are available on our website. So I'm not seeing questions pop up. Jason or Carter, do we have any questions coming in?
No, I haven't seen any.
Okay. Great. Well, then I think that I can give everyone about 20 minutes back to their day. Again, thank you very much for joining. We will be posting this online. Please visit our refreshed website at ohioworkforcecoalition.org. Feel free to reach out to me if you have any additional questions, and we will keep everyone advised about the progress of these and other recommendations about workforce investments to secure Ohio's future. Thank you very much.